To prepare To prepare for a cesarean birth, I have a fantastic resource for that, so I'll link that below. But these top 10 things will include items to consider, not even just the end items that you would need. So for example, one, the biggest thing, set up your support network. If this is major abdominal surgery, you want to make sure that you have people to help you with the bare minimum things that you need. Things like food, cooking, sleeping, getting around, like to the bathroom, things like that, because after major abdominal surgery, expect quite a bit of pain for the first 1 or 2 weeks. So that support network is the biggest thing. The next thing is the pain. So you want to do some major pain management, including icing strategies, compression strategy, but then also just make sure you're modifying your activities and rest when you can. After giving birth, start wearing a belly band as soon as you're comfortable wearing one. So this applies for vaginal or cesarean birth, but for cesarean birth, expect a lot more swelling in the localized area of the abdominals. So compression is going to be pretty uncomfortable. If it's too tight, you'll know it is, if it's too tight, if it's painful. So more compression is not better. Make sure you heed this, because if you compress too much, it's actually going to cause more injury. You'll have more pain. You're going to have more pressure pushing up and or down, causing you dysfunction and pain at the very least in your pelvic floor and making it difficult to breathe. So, but just going back to the first question, start wearing some kind of compression to start right away as soon as you're comfortable, and then eventually for cesarean, see if you can transition that into a compression garment within the first 2 weeks. And while we're on the topic of belly bands, a shaping garment is not the same thing. The purpose of a shaping garment is to compress too much and maximally, so it is not an appropriate item to invest in after giving birth. A belly binder, unless it is designed for postpartum, that ab wrap is also probably designed to cinch up, almost like a shapewear for wearing underneath clothing to suck it up. These are, if they're not designed for postpartum wear, it's too tight. Again, there are dangers or risks of having compression being too tight, at the very least causing more pain, at the most actually causing damage to your pelvic floor, the abdominals themselves, and your respiratory diaphragm. I wouldn't use a corset, but I would use a compression garment. That is optimal. Basically, it's a pair of shorts or pants that are super, super high-waisted and comes up to basically your sternum. And that provides really nice 360-degree compression, gentle compression, 24/7. I mean, as long as you're wearing it, right? And it's comfortable enough to actually sleep in. So the brand that I really like is called SRC Health. I'll link that below along with a discount code. That is a corset kind of item because it is completely surrounding your entire core and goes up high enough. It's generally not needed to wear a belly band at 2 months postpartum. I mean, it's kind of the gray zone. Here's why. Basically, by the 3-month post-cesarean mark, you want to not need a belly band at all. The reason why is the belly band is there to protect you right after major abdominal surgery. So certainly you're wearing it almost 24/7 for the first 6 weeks. But after that, you want to start weaning yourself off at the same time, retraining and strengthening your core. So there's a little bit of, the belly band wearing goes down as the strength goes up, and there's a sweet spot where eventually there's no belly band needed, and then you're using your own strength for that support of your core. So 2 months postpartum, I mean, it's a tough call. I mean, you'll know you'll need one if you try one on and you feel immediately less pain and a lot more support, but definitely use it along with core retraining exercises. Yes, please start walking if you haven't at 10 days post-cesarean. Now, 15 to 20 minute walk is very dependent on a lot of things. And because I don't know exactly your history, here's the things it would depend on. First, you gotta have zero pain walking for that amount of time. But if you do, work your way up to this 15 to 20 minutes. Second, you want to make sure that this amount of walking does not increase what's known as your lochia, that vaginal bleeding after giving birth. Because if you have more lochia, that means that extra walking is irritating how well the the insides of your uterus is healing. So you don't want to disturb that. But in general, movement is so good after a cesarean. Even if you're like day one, just getting out of that hospital bed, making it to the bathroom, going back, getting out of the hospital, walking to the end of the bed and coming back is super helpful. The other thing I would suggest is to ensure you're following an actual rehabilitation program. You know how when someone gets like knee surgery, they are given a 8-month rehabilitation program to follow? Well, a cesarean birth is actually a major sports injury and requires a similar kind of program. So a 6-month program is something that you're looking for. It should include scar massage. It should include cesarean specific exercises, but also don't forget your diastasis recovery. So in my particular programs, walking is part of that exercise program that you want to be able to transition into and then progress into things like jumping and running, because that's what the human body was designed to do, even if you're not a jumper or a runner, right? These are important things for pelvic floor rehab. So I'm going to link below one of these programs that will include a 6-month rehab program. Yes, this is actually very common, but does not have to be your new normal. What you're describing, that burning pain or discomfort, it could be sharp, it could be an ache, it could be exacerbated, especially during movement and exercise. 2 inches above that incisional area, if it's a horizontal line, that actually coincides with the fascial horizontal incision that I really don't ever speak about. But that's a thing. That is going to be tender for amount of time if that area is not mobilized correctly, but also if the exercise program isn't progressed correctly. And then if you're talking about 2 inches above the incisional area in the midline, don't forget, there is that vertical linea alba incision just deep to that external horizontal incision. So that is super common as well. You just want to make sure that gets mobilized and that physically is rehabilitated from a strength perspective. So if you're 1 year postpartum and you've never done any scar massage ever before, scar massage could be helpful in mobilizing the area, certainly with pain management, but actual breaking up of scar tissue, if you've been doing scar massage all along, you could probably benefit from using either tools or having a therapist do it for you. 1 year post, the scar tissue it's just harder to mobilize. It's not impossible, so don't get me wrong. It's never too late. It's just more difficult to do it yourself. That's all that means. And of course, the best option is to get a one-on-one assessment done just to get your strategy created for you that's best for your scar and your abdominals, and in person is always best. But virtual is a very close second best as well. For sure, scar tape can be effective at this time period. Scar tape can be effective even years after any surgery. It doesn't have to be after cesarean. So the scar tape that I'm familiar with is called My Scar Tape by Spider Tech Tape. So I can't speak for all types of scar tapes, okay? But the way this particular tape works is that it can decrease redness, it decreases raised sections of a scar, and it can also really help with keloid scarring. Okay, so check it out. Here's a link below, and if you want, there's my discount code. Hello. Hello, everybody. Welcome to Monday, which would be our